Hi guys, my name is Tess and today we'll talk about something different. We've talked about Down syndrome for a while now, but I'd like us to talk about autism. Autism is a serious developmental disorder that impairs the child's ability to interact, socialize, and communicate. There are various types of autism, and together, combined, they are referred to the autism spectrum disorder. So that the term spectrum is used to refer to a wide range and the severity. So I'd like us to talk about the symptoms of autism. But before we get there, I'd like to give a disclaimer to the parents. Do not use the symptoms that I'm going to talk about solely to diagnose your child. If you feel that your child is exhibiting one or more of these symptoms, just seek the advice of a pediatrician because they are more qualified and they have more knowledge with regards to developmental disorders. First symptom, the child has reduced eye contact. You'll notice that the child is avoiding to keep eye contact most of the time. Second symptom, they have delayed speech or they don't talk at all. So you'll note that the child will start talking, maybe within the first 2 years they talk and then they lose the ability to speak or they do not speak at all. Then the third symptom will be if the child speaks, they might have an abnormal tone, like they are reciting or they are singing. So instead of there's the way we talk normally, and then a child with autism might add a tone or a rhythm to their speech. Then the fourth symptom, the child does not understand simple instruction. As simple as wash utensils or remember to unhang clothes or sending them to the shop, it will be so difficult for them. And then you might feel like they are trying to ignore you, but it's just that they can't understand. And then the fifth symptom, the child will act indifferent or ignore, like you might call out their name, tap them for them to shift their attention to you, but they just act indifferent. That's a symptom. The next symptom, the child will repeat words but will not know how to use them. So they can repeat what they hear someone say, but later they're not able to use the same words they repeated in a different context. Then they also withdraw. They avoid cuddling or touching or hugging, and they will tend to want to play on their own. The child will also have difficulty in recognizing nonverbal cues. So, normally when growing up, if a child is misbehaving and you look at them a certain way, they'll be able to know they need to stop. Or they'll just look at you and understand what you're trying to say. But a child with autism does not. And finally, the way they approach social interactions can be deemed as inappropriate. So, for instance, if you are sitting with your friends or family, the child might be passive, aggressive, or disruptive, maybe to try to get attention or to express themselves. So these are some of the symptoms of autism.